Oh, hey, Bill Lear here. I'm a Mohs surgeon and MSDO program director. And I wanted to go through how I use the HEMIGARD in my practice. So first I'll identify a wound that would be a candidate for it. And candidate wounds are ones that are going to be under tension but are in fragile skin. And that could be anywhere that's fragile. Usually it's shin and forearm skin in the elderly, but even like some facial wounds can be tense and have fragile skin. So first I'll identify that combo of high tension and fragile skin. It should be relatively hairless area, so it's not great for hair-bearing scalp. Make sure the area is clean and dry first, and then you apply a HEMIGARD to each side with the rigid portion facing in. The reason the HEMIGARD is so great is that when you do the next step, which is take a retention suture with a needle, and we sell a great one, go through that hole with the needle, come out with the needle through that hole, and when you go to close that wound, this is craft paper, which would normally rip at very low force. You can put a large amount of tension on that advancing edge before you get any suture ripping. So you oppose the wound, you get the wound together. 6 times of the wound tension of an elliptical excision is found in that middle suture. The next sutures are very easy to do, so you want to complete your layered closure. So at that point, once the wound is together, you'd put a suture here, like a deep suture here. My preference is a polysorb or a vicryl. So a deep suture there and a deep suture there. And then, after you've put in your deeps, my preference is to actually use glue and steri strips for the superficial portion of the layered closure, for the rest of it after you've done your retention suture in the middle. FDA validated for 2-week retention, so you leave this in 10 to 14 days. When you go to remove it, you'll lift up the rigid portion first. After you snip the suture, the rigid portion will come up very easily at that point, and then you peel off the rest of it. I've used this in about 100 cases so far. No issue with blistering. This is a very nice low-tack adhesive that we use. Advantages of using this over off-site retention tape or sewing through steri strips is that when you sew through those materials themselves, if you orient them this way or even that way, they get soaked with blood, and then after 2 or 3 days, they start to smell. HEMIGARD is reinforced at the edge, which is where you need the tension reduction, waterproof coat, but the trailing edge is a nice stretchy non-woven. So when you put that wound under high tension, you're not getting a lot of shear force at the trailing edge, so you get less blistering when you do this kind of procedure. Works great. I've used it on foreheads, I've used it in shin, I've used it in forearm, on very, very large wounds, and it's been great for my patients. We also tell you and give your patients a little card so that they know how to care for the wound after we've done it, and they understand, hey, what did they just use to close my leg wound? So we're super excited about it. I'm super excited about it. I'm the first customer of it, and we'll be a continuing customer for sure, and we hope you are too.